Hello, everyone, and good afternoon or good morning, depending on the time zone you're in. Very happy to have you join us for our Rural Prep Professional Development webinar, Connecting with Underserved and Understudied Populations Through Research. We have three guests with us today who will be presenting from their unique perspectives, and then we will hopefully have 20 minutes or more to interact with you as an audience, answering any questions you might have, and allowing you to interact with our panelists. So let's get started. I will begin with an introduction, after which each of our panelists will present in turn. This is the theme of their presentations. And then I will be leading you in a time of audience participation. Dr. Patterson is participating by audio only today. Rural Prep is a collaborative. It's an acronym for Rural Primary Care Research, Education, and Practice. And as part of HRSA's Bureau of Health Workforce Initiative, its goal is to promote a community of practice in evidence-based training in primary care education. Our mission is to improve and sustain rural health through community engagement and research in primary care, health professions education, and by primary care, we have generally been including physicians, nurse practitioners, and PAs. These webinars are intended to strengthen our community of practice around this goal, and we hope that is the case for all of you participating today. Generally, these are presented 4 times a year in July, December, May, and June on the 4th Thursday. We're 1 week early this month because of the Christmas holidays. Our objective is several-fold. One is to enlist community partners in connecting with underserved and understudied populations. We hope that following this presentation, you will be able to do so. We hope that you will be able to identify local resources, existing relationships, and academic contacts who can assist you. And hopefully, by the time this webinar is over, you will be able to articulate at least 2 strategies for engaging these populations in the design and implementation of research. We want you to consider patients' desires and perspectives, as well as the sensibilities of a community in the work that you do. So without further ado, we're going to proceed with our 3 panelists. Nathan Ord is a 4th-year medical student from the University of Washington School of Medicine, currently presenting from Idaho, where he's on the interviews trail. Nick Pushedley is a 3rd-year student at the Ohio University Heritage College of Osteopathic Medicine. And Melissa Thomas, one of our faculty here at the Ohio University Heritage College. We're really pleased to have each of them with us. Nathan and Nicholas were both awardees for a micro research award. And Melissa was Nick's mentor for his project. So we're happy to see this come to be as a result of our micro research efforts. So without further ado, I'm going to stop my screen sharing. And Nathan, if you want to share yours, we can get started.
I hope everybody can hear me all right here. I'm going to talk a little bit about my project that I worked on, and also engaging community partners and how it was relevant in the setting of that. And my project was called Homeless to Housed. And I worked with a mentor, Dr. Robert Urata in Juneau, Alaska, who's an adjunct faculty with the University of Washington. Just got to click to move the screen forward. So I guess this, for me, it started with an interest in this population. So I'd done some work with super utilizer programs for high cost, high complex populations. That was what led me to Housing First, which provides rapid access to affordable permanent housing, along with access to social services. And Housing First has been shown to reduce public service utilization and improve residents' quality of life after joining. But it's primarily been studied in urban population centers. There's been some work done in Vermont and other places as well, in rural locations. But there's, I don't think, any previous work coming out of Alaska. And that's my hometown here on the right, or at least the mountains above it. So I wanted to learn a little bit more about what this would look like in Juneau. And so that kind of brings me to my opportunity to study this. Juneau is a town of 32,000 people without any road access. And in 2017, the Forget-Me-Not Manor opened to 34 tenants. There's about 210 or so folks classified as homeless in Juneau by the last count that they do during one night in January. And this is a mix of folks who are living on the street, living in the woods, kind of unstably housed. And then the tenants selected for Housing First was selected using a vulnerability index. And in the first 6 or so months after opening, some of the preliminary data showed massive reductions in the emergency room visits, including decreases in rainforest recovery sleep-off visits, which makes sense as folks now had a home to go back to and a bed to sleep in, and then also reduced contacts with police officers. So I wanted to know, like, how can I get involved in this? This is something I'm interested in. It's going on in my hometown, and I'd like to learn more and support this work. So the questions that kind of started me off were, who is already doing this work? So I got in touch with folks on the board of Housing First in Juneau. There's a researcher who was who made that previous table, who I got in touch with to talk about developing some research regarding this. Folks on the city council, Scott Ciambor, and others who identified who are already doing the work that I was interested in, and who knew a lot more than me. I was kind of setting this up when I was on a rotation in Bozeman, and I was like, I'm not close to the ground. I'm not close to this project. Who knows more than me that I can enlist to teach me about designing a question? And then what questions are they interested in? I felt like it'd be fairly arrogant as somebody who's outside of that system right now to be like, I'm going to come up with a question that's going to be the best question, but instead reach out to the folks who are there, who are doing this work, who maybe had an interesting question come up, but didn't have the time to pursue it. And then it was, how can I support their work? Because I truly believe that caring for homeless populations is important to our community. So how can I add to this project that's going on? And what perspective can I bring to the project? Being a medical student, I felt that I could bring sort of a medical approach to it that might not be going on right now. And then what experience or reputation can I use to leverage and open doors in Juneau to get access to these people? I had relationships back home in Juneau, and I was able to reach out to those folks and, through a series of events, meet other people who are involved in this. And then it's the beauty of a small town that you can talk to people who can open the doors for you. And some of the questions that came up when I was talking to people, questions around residents' quality of life before and after Housing First. Residents seem to thaw after joining Housing First. When they're living on the streets, they don't often or aren't always diagnosed with a lot of chronic medical conditions, but after joining Housing First, they seem to start amassing more conditions. And is that because they're things that are being diagnosed, or is that because there's something about living, living on the streets that tends to keep people a little healthier? What do residents like about Housing First, and what medical burdens do folks have? And that sort of all came together into this question. How does stable housing affect healthcare utilization, perceptions, and perceptions in residents of the Forget-Me-Not Manor in Juneau? And so the partnerships that I said about developing, I sort of talked a little bit on the previous slide about collaborative question development. So working with people who are on the ground, engaged in this work already, to come up with a series of questions, or to work on making a question together. And then once we had a question, how do I go about getting participants? And that recruitment problem was important to reach out and find people who are close to this population. And then what extra resources could I engage? And I think Nick will talk about this more, but for me, that really came through the University of Washington in terms of getting releases of information and that sort of thing. And also identifying the local mentorship. So I ended up finding a Dr. Robert Urata in Juneau, who's been practicing there for 30 years, who's a really good name in the community. And by using his name partially and having his weight behind my project, it opened doors to get access to the Midtown Clinic, which is a clinic that was attached to the Housing First building in Juneau. So I was able to set up shadowing opportunities there, meet the clinic operators and the clinic staff, and then go next door and meet the staff at Housing First and talk to them about, what I was interested in, what this question was about. And they're the folks that were able to really help put me in touch with the population of people I was interested in talking to, and helped arrange times for people to sign up and get involved in the research. And I'll let Nick talk more about the institutional support stuff. And things that were helpful to me in terms of finding partners was keeping a document of, where I had names, associations, notes about people, so that I could kind of use that to reference people and stepping stones to get to somebody who could help me get access and get involved. And then knowing the why I was doing this work. And really that came out of wanting to work with this population in Juneau, make my hometown a healthier place and care for an at-risk population. And by aligning my sort of why with the goals of the program, it became about how can I support you, and they were interested in supporting me as well. And so this is, my study kind of broke into two portions. One is looking at healthcare visits, and the other was a series of interviews with folks at Housing First. So I collected the healthcare data from about 4 locations in Juneau, which were the primary places folks were going to get healthcare services. Search, which is the native hospital there. The native clinic, it's not so much a hospital. Bartlett Regional Hospital, which has the ER and the inpatient. Juneau Alliance for Mental Health Incorporated, which has multiple locations throughout Juneau, but is also next door to the Housing First program. And I thought what was really interesting is before and after joining Housing First, prior to Housing First, folks were primarily going to the hospital, and on the I guess the graph on the right, primarily going to the ER to get their health care. But after joining the program, there was a massive increase in the clinic visits, so folks were going to more outpatient visits. And then in discussions with them, they really mentioned the Housing First staff is really important in that, and the social workers who help them get to appointments, take their meds, set up appointments, and who also went with them to appointments often to help them establish a good relationship with their physicians. And then another interesting thing, I've been trying to look more at the comorbidities associated with folks. And this is just some graphs that you can see. I used the Utilization Comorbidity Index, which classified a bunch of ICD-10 diagnosis codes into different categories. And then before and after Housing First, used that as a proxy for why people were going in. And alcohol is a primary concern for people, and an ongoing struggle for a lot of folks there. And as well as like high blood pressure, fluids, and then liver function and that sort of thing. But before and after joining Housing First, you can see it's pretty similar. And then the other part of my project was qualitative interviews. There was 2 interviews spaced 3 months apart. One was looking at the definition of health of people, health prior to Housing First, health since, and perceptions of healthcare services. And then the second was about the history before and after joining Housing First, and then the history since the first interview, and then ways that people have been identified to improve their health or really their engagement with the healthcare community. And some themes that came up throughout these interviews were health is food. Health was having a lot of food. Health was being able to have food at home that you could eat, and you didn't have to go seek it out, didn't have to bum for money to go get something to eat. Health was warmth, a warm place to stay, where you didn't have to sleep in a doorway or try to make some alternate habitation in the woods. Health was less pain. And what was interesting, because people actually mentioned alcohol as one of the things that primarily helped them with their pain. And then violence. A lot of people talked about by now having a home, they had a place that they could go back to, they could lock the door, they didn't have to let people in, weren't getting in fights as frequently, and that kind of plays into the privacy component as well. They weren't having their things stolen all the time. So they had the ability to have a place that was theirs, had some security in that. And also the community of where they were living. They were living with residents that they cared about, and also the staff there. Again and again, people talked about how much they cared for the social workers that really helped them get to their appointments. They were their jack of all trades, therapist, taxi driver, pharmacist, etc. And then thinking about the future, once folks were housed, they were able to start thinking past tomorrow. And thinking a little bit about what am I going to be doing in 6 months, a year? Am I going to be trying to find a job? Am I going to develop a long-term relationship with a physician? And the quote that really struck me that I wanted to put in was, "This place changes people for good, makes them feel like they've got something." I mean, shit, when you've got a piece of sidewalk, that could be taken away from you at any moment. And that just, I thought, was a really powerful reflection of what Housing First meant to a lot of people there. So some last key points that I wanted to talk about in terms of what my work and maybe some takeaways is knowing what is your why. For enlisting community partners, by really knowing what is your reason for doing this, you can kind of align your goals with theirs, and it makes people want to help you. And then your opportunity, where can you explore this, and who do you need to identify that can help you explore this? Whose permission do you need in the community to get access to your participants and to help you develop a question? And how do you get your foot in the door? Whether that's using local experience to leverage other contacts or that people will trust, or otherwise. And then in identifying your partners, who knows more than me? Who knows more, like, that can add to my question? What questions are they interested in? What would you like to learn more about? And how can I support the existing work that's going on? And what perspective or experience can I bring to this problem? What is my additional benefit to folks? And that sort of wraps up what I've got to talk about, and I'll pass it on.
Okay, let me get this set up. Okay, my name is Nicholas Pachedli. I'm a third-year medical student at Ohio University. And so today my presentation is about engaging LGBTQ participants in research, and more specifically identifying local resources, existing relationship, and academic coaches. So really, just a little bit about our research to begin with. I worked with a team, and we set out to identify really healthcare issues among rural gender minorities. So we were looking at kind of the experience of transgender people living in rural areas. And so we used a 40-item mixed method survey, and we defined rurality using the fields below. So we're in the process of analyzing our data and developing our manuscript, so that research will be forthcoming. But getting back to this issue of engaging LGBTQ participants. So for a successful project, there are really so many components. And so really, you need to have sort of a broad view when you approach this topic. But I think for us, it was really looking to relationships that existed with Ohio University and local resources. So that's organizations in the state that worked with LGBT people was so important to getting this project off the ground. So this question of identifying local resources, so for us, we looked at healthcare organizations. So that would be particularly Equitas Health. So they are an LGBT specialty primary care healthcare organization, and they work in Ohio, but they also do community advocacy. And so for us, they were important because they had resources we could use. For instance, our demographic field on our survey came from them, but then they also have a newsletter and a lot of outreach operations. So working with them was so important. Dr. Thomas, who I work with, she's worked with Equitas in the past, so we were lucky enough to have a connection. And then in terms of community engagement, we worked with we didn't really work with this organization, Trans Ohio, but they helped distribute our survey. And so we had a professor who actually put us into contact with them. So we were lucky that we had a lot of these groups that we could reach, which was so important because thinking about rural LGBT healthcare experiences, we expected them to be less connected to these resources. And so we wanted to make sure we casted a wide net. And so in the end, we got a fair amount of people who lived in rural areas in our survey, and so we were very proud of that. And then for me, someone who is new to research, I was interested in the idea of like formal versus informal relationships. So there were names listed on websites, people that we could contact, but then there were also people in our network. So for me, I have a friend who does transgender issue advocacy work, and so they kind of helped us, or helped me, think through some of the goals of our research, and they looked at some of the language that we used in flyers and contact with people, to get in contact with people. And so I think in the end, really the informal relationships that we had with people in our university, with people that I knew from volunteer work, etc., was just as important as the formal relationships to creating a successful project. And then, so really, the relationships, what do they help you with at the end of the day? I think for us, there were a lot of ethical considerations. Specifically in survey design, there was this idea of transition. And so we looked at other research, and they asked about like gender transition in some of their surveys. But then when we talked among our team, and then when I reached out to some of my contacts, we ended up dropping those questions because we thought they were maybe a little traumatizing, or they weren't within the scope of our survey, which was about primary care. So that was, we were really glad that we went through that process. And then again, participant recruitment. So really making sure you're getting on those email lists of organizations in your state or nationally, making sure that the materials you're using are acceptable to people, that they say what they want, say what you want them to say. We found this issue of, in our flyers, we were saying, if you identify as transgender, and one of my contacts said that you should just say like, if you are transgender, because it sounded a little patronizing. And so we did modify some of the language that we used. And then just being connected to the community and the goals of your research, thinking, what are you trying to do? So we wanted to help practitioners or organizations that work with rural patients or are in a rural area working with people. So giving information that might be useful to them. And then again, identifying academic coaches. So I was very lucky to have Dr. Thomas, who advised our project, and really our entire team of people who worked with us. But then there were so many people that, I really will have to thank in the acknowledgement sections who contributed to our project, because people, they might point you to, an article that you should read, or an organization that works with the population that you're studying, and so there's just like many opportunities to, improve your project and find something that will be helpful to you. So I think it's just important to, be open, and, you might talk to someone expecting to get help with recruitment, but they might, give you some other advice. So in conclusion, this kind of research is very multifaceted. So we had to really focus on identifying rural participants, but then we also had to think through some of the issues with conducting LGBTQ research. That's, could be your demographic section on your survey. And so we used a lot of resources in terms of people and organizations that helped us along the way. So in conclusion, just really be open to how people will help you with your project, and don't be afraid to send out emails and to just get in contact with people and ask questions. So thank you.
Okay, well, thank you all very much. To Dr. Longenecker and Dr. Davison, thanks so much for the opportunity, and very pleased to be able to be co-presenting with such a distinguished panel. I am actually going to be able to tie in a couple of the wonderful comments that were made by my co-presenters, Nick and Nate. And so they've done a great job in setting up this last presentation. My topic today is really looking at the research I've conducted the last over 2 decades and working with Amish and Mennonite and Plain communities, and wanted to share more of that community engagement piece and to share possibly a consideration for a framework with which to explore and engaging any community where one may not be a member. And here is just one model that might be of help to share. And when we look at traditional research, we often are exploring research that's really on a community. So there's a topic or a need that's been addressed or discovered. And so we often see in research where academic partners or researchers are conducting research in a community that there's really not much of engagement between the two groups. Community engaged research, though, focuses more on research that's conducted in a community. There is more opportunity to work with that community setting. But I think that what we see more and hear in the literature is this new concept of community participatory or community participatory based research. The research is conducted with a community, so there's much more engagement. And if I could draw just an extra section box to this continuum, you know, the work that I'm doing in many ways really expounds upon these 3 models and looks at community-led research. And so how can we empower communities with the tools they need to be able to have the skill set, to be able to be researchers in their own communities and have that full control of the questions that they want answered, and utilizing partners, resources, academic institutions to be able to have that network to be able to answer their own questions, to have the tools to take care of their own health. And with that, and I think that I appreciated Nate's comment about knowing your why individually and how that's so important to the research process. I know that often what we see in traditional research models in addressing health disparities, whether it be a public health focus, which is more my background, or even looking in the medical field, is that when we're exploring needs in communities, we look at the what, we'll look at the disparities, and we move to how we solve them. And what I'd like to propose is that there's this other key component that we often miss in research, and that is really understanding the why. And so when we're looking at disparity, whether in my research is more cancer disparities, and maybe discovering that there is a particular burden of a disease, instead of focusing on how we're going to solve that, this critical aspect of stopping and asking why. And really the only way to discover that why is to ask the community and have the community engaged and truly participating in the research that's being conducted. And I'd like to share just a couple examples of that in the research I've done the last 2 decades with Amish and Mennonite communities. We founded a program actually over 20 years ago called Project Hoffnung, which is the German word for hope. And this really centered on research that I initially had conducted that looked at higher breast cancer mortality rates among 2 of the world's largest Amish settlements located in Ohio. And from that work, a community-led model was proposed that actually focuses on a few key areas of research that these next few slides will share. And just to give you a little background, there are 31 states and counting that have Amish populations that exist. And Ohio, again, has 2 of the world's largest Amish settlements and dozens of smaller Amish and Mennonite communities that exist within our state and surrounding states as well. We can talk a little more about some of those unique barriers that exist for Amish and Mennonite communities in accessing care that many times are not unlike what we experience in rural communities, whether that's access to transportation, to health insurance, and actually just even access to healthcare providers. And that's been part of the work that we've done and been able to diminish some of those barriers associated with just accessing care. And again, I referenced earlier research that I had conducted that looked at higher breast cancer mortality rates among the Amish in these 2 particular settlements in Ohio. One of the ways that in these last four areas in addressing the burden of cancer that we've explored was obviously providing culturally competent breast cancer education to Amish and Mennonite communities. And our work has followed and be able to show the effectiveness of developing programs led by community health workers and members trained in the community to deliver that education and work with communities. Clearly, we provided access to breast cancer screening and follow-up through community partners and also healthcare providers throughout the state of Ohio and mostly our rural and Appalachian counties. The other piece that we've addressed is developing a culturally competent training program to healthcare providers, hospital systems, and agencies who may not actually have the knowledge and understanding of the cultural considerations and concerns that community members have in addressing the healthcare needs of their communities. And of course, in this particular study, could not rule out a genetic predisposition to breast cancer, which is part of the ongoing research that we're conducting right now, thanks to the partnership with Ohio University and its College of Osteopathic Medicine. Now, this is a busy slide, but I want to reference too, as Nick pointed out, truly the benefits of institutional support in working in any type of community engaged research. But in sharing in this slide, I wanted to just mention the amazing partnership that exists between a community-led nonprofit organization that was established and I founded in 2011 called CARE, which we refer to as the Center for Appalachia Research in Cancer Education, and to see the strength of the partnership that's been established with the institutional support at the Heritage College of Osteopathic Medicine at OU. And this collaboration provides the type of community expertise and relationships in addressing the needs of a community with the infrastructure and clinical support and education and research that an academic institution and university can provide. And all of that fields into an incredibly successful community-led initiative that's specifically addressing the needs of the community. And this all really has centered on understanding the why in the community and be able to find opportunities for communities to be engaged in this level of research. Now, one of the particular projects that I'm excited to share with you really did stem from understanding more the needs and concerns of a community. And as some of you may know through media, often we see Amish and Mennonite communities portrayed in media and books and other forms of communication that often focus more on the mythical or more tantalizing aspects of a culture. And since 2011, with the advent of additional docudrama TV shows that were really depicting not at all the true Amish culture, this became a serious concern to many of the Amish and Mennonite community members with whom we served. And there was not really an opportunity for community members to have a voice in what the world knew about them. And through a 4.5-year initiative with a complete community-led participatory project, we were excited to launch a very unique, really shift on what we call a research framework of the Photo Voice Project, where often communities are given a chance through the use of taking photos to share their particular viewpoint on a certain social issue or health aspect in their community. In this particular case, we were able to work with a trusted photographer who was given unprecedented access to Amish and Mennonite families and homes to be able to make sure the community owned all of the photos, that they were able to down select thousands of photos into a photo book project with 50 particular images and stories written by the community about their own lives and their own perspectives about what they wanted the world to know about their community and culture. This project is so interesting, and not only in that it's really the first of its kind photo book that is giving an opportunity for the community to completely lead the project, but that we're now utilizing this photo book as an opportunity to train healthcare providers, medical students, and other social science researchers and faculty and students, and seeing how we can hopefully engage in increasing intercultural communication and knowledge about working with Amish and Plain communities in a way that's actually been completely led and really taught by the community members themselves. I guess a few lessons learned, and again, a comment and kudos to both Nate and Nick. While working all with very diverse population groups, I think our lessons have many similar ties, And one, I think, particular point is knowing your place. And my other two co-presenters have effectively spoken of this as well. I strongly believe that you don't have to belong to a community to help. But again, I do think you have to know your place. And in each of these examples, while we may all have the best of intentions, none of us particularly may or may not identify with communities with whom we're serving. And so it's critical to know and important that community members are often and always have that chance to have their voice heard and have opportunities for leadership in these type of research projects. And I know that one of our former community members shared this beautiful analogy in working in a multidisciplinary and academic and community-based partnerships, is that we're all like pieces of a puzzle. And when we come together, we make this beautiful, beautiful picture. But each piece is so important, and not one is bigger or more important than the other. And I think if we understand the value set of our individual partners, and not only from the community, but academic and research settings, we really do come together as a truly collaborative project. And I think we've learned in these three examples is that truly the questions and answers all do lie within the community themselves. And while certainly in the case of examples that we've had, while we may see through data particular burdens or needs that communities might face, we have to stop and pause to know that community members themselves may have other issues that are of bigger importance and are more important to focus on than maybe what the data may show. And that it's so important to not assume those questions and answers that the community members themselves may want to address. And I think that's very important in this type of research, that in understanding the needs and values of a community themselves and how we can work together with tools and resources to make that happen. Again, a couple references, but looking forward to entertaining questions from all of you. And again, thanks for this opportunity to share some very neat perspectives in three diverse population groups, but still finding that common bond in the work that we're doing in community work.
Randy, you are not unmuted.
Sorry about that. I'll start over again. Thank you very much, Nate, Nick, and Melissa, for your presentations. I really enjoyed Nate's comments about community collaborative question development. I liked Nick's emphasis on accessing both formal and informal networks in getting the resources and the academic and community partners that you need. And then finally, Melissa, for leading us from research in the community to actually community-led research. I think that was a really nice set of presentations, and I'm looking forward to discussions. Just to remind you to enter your questions and comments in the chat box and select all panelists and attendees from the drop-down menu. We already have at least one question, which I will start with, and then there are some others that I would like to lend as well. So we'll start with the first question, and I'm going to stop my screen sharing just so that if the rest of you want to, you can put this into the matrix view and see all of our panelists. The first question was a fairly straightforward question. Has anyone of you participated in or worked with the NIH All of Us research program? Any of you aware of that? I'm not. Davis, are you?
Yeah, it's an initiative of the NIH, obviously, and it is, from what I understand, it's an attempt to develop a large research data set of genetic data, but I think other kinds of data as well. And there's been a huge recruitment effort, and the idea is to be able to engage in research that will help us identify precision therapies and there was an engagement with rural stakeholders at a couple years ago at the National Rural Health Association conference to try to have rural people and other underrepresented groups submit their information to this database. But that's as much as I know. I'm not sure what the status of it is right now.
Well, it certainly sounds like when you're looking at understudied populations that the NIH might be interested in what you're doing, and there's no harm in looking out and reaching out for additional connections. So hopefully the three of you can check into that. I do have a couple questions, and this has to do with first the researcher themselves and the biases you yourself might bring to working with any particular population. How did you address that?
Well, I think for me, I think that I guess I had a lot of experience in terms of volunteering. And so I felt like even though I wasn't a trans individual, I had experience in the LGBT community. And so I felt like I had familiarity with the topic. And then of course, you know, you do your own research and you consult the literature. And so I think I had, I felt like I had exposure, and then I also had the ability to like learn more and read more.
Yeah, good. Either of the two of you?
Yeah, I was going to jump in and say, I know from my experience, I mean, growing up and living and still in a rural area here in Ohio, I understood rural culture, but I had never really engaged with Amish and Mennonite communities. And I have shared previously that so much of my work involved face-to-face interaction because of limited technology options and engaging with this particular community. And I was so worried about being politically correct and not being offensive in any way that my actions often felt very impersonal because I didn't want to make a mistake in what I was saying and doing. And it was really through an interaction of another colleague with whom was hired on our project that I noticed how easy it was for her to interact. And she grew up in a large city. She had no experience in rural areas, but she was just more her authentic self. And she had such an easier way to engage. And I think it was my fear of being offensive that really distanced that relationship. And it was really through that open conversation with many of the earlier community members who shared that, listen, we know we're different and we know we have made different beliefs, but we know that you're coming here with an honest heart to want to engage with us and help us address our issues. And so it really humbled me in understanding more that in much as I thought that the community was so focused on our differences, it was really my own personal bias that this was of such concern to them, because it really was more an issue of coming together and wanting to make an impact and help the community. That was far more important of a value set than what differences we may have had in our daily lives. And I think it's something I take to heart in working with any community group, that we often have many more similarities, and finding that common bond between us is far more important than possibly looking at these little potential differences that we have in our lifestyle and preferences that to me made more of an issue than it did for the community.
Yeah, I like that emphasis on not just checking your assumptions at the door and trying to be real neutral in a fearful kind of way, but being your authentic self and trusting the community to accept you, all the while maintaining cultural humility while you do that. Great. Nate, any comments?
Yeah, it's hard to expand upon that. That was really nice. I think in my process, I did a lot of interviews with folks, and certainly it's hard not to bring some preconceived biases and notions into this setting, you know, especially when you're interested in not only the like healthcare utilization from a cost like reduction standpoint, but also from improvement of quality of life standpoint, but really trying to create open-ended questions that allowed people to answer without leading them one way or another. Definitely a hard thing to do, but I can think of one participant in particular that I asked, what does it mean to be healthy to you? He's like, 2 beers. 2 beers is what gets me up, feeling good, and lets me go about my day. And I was like, okay. And just asking people, what it does for them, and then not trying to withhold any judgment and be like, well, about your health, but instead being like, that's what it means for you, and I'm going to meet you where you are.
Well, thank you. We have a question from Kathleen Quinn from the University of Missouri, our academic health center. She says, very informative presentations. Our academic health center School of Medicine strategic plan includes bringing research to communities through our extension network. And so she's just making the comment that your presentations will be very helpful to that effort. I have another question for you, and that is there anything that you felt looking back, or maybe if you're in the midst of this work, anything that you became aware of that you were missing, that you had completely overlooked in your first attempts?
Yeah, so something that I didn't consider when we went to NAPCRG and we did like a preliminary presentation of our first data, and we got some feedback. And so it was about how we stratify or determine the socioeconomic status of our participants. And so we used income and education, and someone told us, well, you can also use things like food security and housing security. And so I think that was a case of us kind of having like a preconceived notion of how we should be doing things. And really, we didn't think about like the idea of, it's the socioeconomic status, how do you stratify people? How do we think that our participants will fall in on that scale? And so that's something that I still remember to this day, like, oh, it would have been so good to have those questions.
Excellent. Melissa?
Yeah, I to echo that too, Nick. There have been some great lessons learned in working on our project together. That's a very good point. I think it's always easy to go back and see, I wish I had asked that question or that particular framework, which I think is wonderful, again, to stress the importance of that interdisciplinary approach to this type of research, and how much benefit there is in understanding the frameworks and disciplines that are out there that could enhance your own work. And I know it's been beneficial for mine as well. I think one of my lessons learned early on is that I was so focused on engaging in the community that once I had reached that type of community support, which I'm sure we all can and state takes years at times to establish that trust, I recall going back into these communities and working with community partners. I'd established the community partnerships first, and then had gone back to work with community partners. And it was really humbling for me to sit down then with local hospital systems or providers. And I had just made the assumption that we were all going to be so excited to work together. But I found that some of the partners also saw me as an outsider, right? Because I had not established those relationships with these other partners that had had a long-lasting relationship. And I think that in retrospect, I would have worked in tandem to enhance those relationships. And while one certainly I didn't view as, omitting from the other, it was definitely a lesson learned. And again, quite young in the process, that just as much as I had to establish that trust and relationship building with the community members, I also needed to do that with the community partners, because I also was someone not from that community, and really building and strengthening those relationships that you have, not only from a community partnership standing in healthcare agencies or other partners, but being able to establish that trust as well. So definitely something moving forward then. We got community agencies involved, or academic institutions or other researchers involved much earlier in the process, to make sure that we all were on the same page and moving forward with relationship building.
Excellent. It's good to be reminded that I'm not the only game in town. Yeah.
Randy, I have a question. This
Yes.
is Davis again. And this may be for Melissa, but I think Nathan or Nick might have some ideas too. To do research with the community or community-led research takes more time than traditional research on a community. And just for context, I mean, Nathan and Nick both had one-year projects with limited funding to do that, and are busy students. But that's also, I think, for faculty, a lot of times we have projects that are on a short timeline with limited resources. And so I'm wondering, are there ways that anybody can think of to inject elements of that community participatory approach within limited resource constraints? And I mean, I guess I'm wondering, are there any shortcuts that we may not get all the way there, but are there pieces of that that we can bring to a more limited project?
That's a really great point, Dr. Patterson. And I think that both Nate and Nick shared examples of this as well, where I think Nate specifically mentioned that a key focus was that he already saw what partners were already out there conducting research. And so, you know, he made that effort to be able to reach out to those who are already connected to the community. And I think that's a very effective way for both faculty and students, even on a short time frame, to work on a project like this. I know not a topic today, but I'm conducting another study on food insecurity. And I know that in particular, I've had 3 med students who have come forward to express an interest in working with this topic with a slightly different research perspective. And we've been able to engage medical students in specific time-limited short-term research projects with existing research that we're conducting that's enhanced our survey development, it's enhanced our data collection, and provided a very unique opportunity for students and faculty with which to be engaged. And just like Nate, I also reached out to other experts in the community who may have had opportunities to be engaged in a particular population group to make sure we were reaching all aspects of that community. So I think, again, in all 3 examples, to not be afraid to reach out to other experts in the field. And I think if you're really able to express the importance of the work you're doing and your interest in really helping and engaging in communities, I think that that trust can be established to be able to be engaged and provide that opportunity for an invitation or a chance to really be a co-investigator on a study for a short-term period. That's a really great point, and one I know that is often challenging in academia and in school to be able to do large-term projects like this that do require sometimes years to establish that trust.
Nathan, I liked what you said about leveraging the trust already there with a 30-year practitioner.
Yeah, I guess I can speak to that sort of briefly. You know, I was in Juneau doing a med school rotation. It's also a place I'm from. So I knew of Dr. Yarada, and I knew his reputation in the community and his engagement in the community, you know, and in both the participants and then in recruiting my community partners, you know, talking to them about working with Dr. Yarada to work on this project really opened a lot of doors for me because he'd been there, he'd established those relationships. People had a documented history of engagement in that community. So, you know, having his stamp of approval on me sort of let me be a little bit of a proxy for his reputation.
Excellent. I don't see other questions in the queue, and we're at about the end of our hour. Is there anything any one of you wants to say yet? Panelist.
Just a thought I'd like to share, and I so appreciate the format of this particular webinar that's allowed an opportunity to showcase 3 very distinct population groups, but really similar, I think, frameworks in which we've been able to showcase ways in which we can engage in communities and really give communities a voice in sharing their own concerns and issues, and hopefully empowering them, again, with tools to take care of their health. I think often when we work with diverse population groups, we focus so much on the differences or some of the unique challenges or even opportunities that unique populations face. And I think what's beneficial about a webinar setting like this is that we can come back together and see some of the common processes and lessons learned that, again, I think are quite similar regardless of population with which to be engaged. And so again, I think that coming together and appreciating some of the common methodologies and best practices in engaging in diverse and often underrepresented communities is a really great framework that we can learn from one another regardless of the population that we're trying to reach. So again, I certainly learned from this as well, and it's been a pleasure to understand some of the opportunities that we can be engaged in communities and understand how we can help address those issues. So a special thank you for the opportunity to be here today.
Well, thank you all for participating today and presenting your insights. I like ending on that thought that perhaps the place to start is on similarities rather than differences, and joining the community before you start your research in with them. I just want to make you all aware of our upcoming Rural Prep Grand Rounds events. These are team-based events, so you have to join as a team. But in January, Dr. Scott Anzalone will be sharing with us a day in the life of a rural doctor. And then in February, we have folks from 3RNet leading us in a discussion of looking for a job in rural practice. Here is the evaluation link that is also in the chat box, or you can point your phone at the screen and use the QR code, because we really are interested in your feedback, additional questions. This webinar will be published in the not too distant future, hopefully within a week or so. Given the holidays, it may be a little longer than usual, but we'll have contact information there as well. Here are our contact information as the leaders of Rural Prep, Davis Patterson as project director, and myself as associate project director, and Dave Schmitz as our dissemination lead. And if you can't remember any of our emails, just send a request to rprep@uw.edu, and it'll get to the appropriate person. So thank you all so much for your participation today, and I hope this was helpful. Have a good holiday season and a happy new year, all of you.